Sierra Leone, Guinea and Liberia continue to battle the Ebola virus that's killed nearly 6,400 people. But the focus is also turning to rebuilding shattered health services in the worst affected countries. Speaking on Thursday at a World Health Organization meeting in Geneva, Guinea's health minister said Ebola had revealed weaknesses in its healthcare system. Remy Lamar warned it would take some time and a lot of funds to rebuild it.
In the long term, it will take us at least 5 years to establish a strong healthcare system that is able to face any potential epidemic. It has to be put this way. We're in a world of perpetual mutation. Today it's Ebola, tomorrow it could be a different epidemic. So we need at least 5 years to put a strong healthcare system in place. And regarding the budget, it will come to around $300 million for Guinea.
And it's a similar story in Liberia, where more trained staff and better facilities are desperately needed.
We want to expand the health workforce because it's crucial for providing quality health care. We want to increase the number of nurses, midwives, doctors, specialists, and community health workers, and also looking at the managerial cadre, the managers, over the next 10 years. And that budget comes up to about $200 million. It's an average of like $30 million annually from the beginning.
Maintaining a unified response at the community level is also crucial to containing the outbreak.
In all cases, we're most likely to see reduction in the number of new people infected if communities are fully involved. I call it now synchronized, localized implementation to combat Ebola. Synchronized, bringing people together, localized, because it's very much adjusted to the local level, and implementation, because for me now, the absolute emphasis is on doing the work as well as we can, getting into communities, identifying people who are ill, making sure they're treated, getting the contacts identified, and then keeping them under surveillance to see if they get ill too.
There are important lessons to be learned from the battle against Ebola, say some health officials.
The systems and the resources which have been and are being mobilized for the Ebola response should be integrated into a sustained post-Ebola health infrastructure and services.
Sierra Leone is now the worst affected country in the Ebola outbreak. The country's health minister, Abubakar Fofana, has said he's drawing up a 5 to 8 year plan to rebuild and strengthen health services once the virus has disappeared. Clementine Logan, CCTV.